Good morning, sir. How are you doing?
Good morning.
How are you doing?
Very well.
Please introduce yourself.
I'm Percy Chibber. I'm the mentor and director of urology of the Reliance Foundation, Mumbai.
Okay, great. So, sir, why did you opt for this specialization? Please share your professional journey till date.
It was because I was working under a urologist. This was more than 35, 40 years ago when my chief was a general surgeon with a great interest in urology. And I developed that in urology. There was no training in urology in India at that time, at least not in Bombay. So I chose to go to the UK. I trained in urology in the UK. Then came back, I started practicing in India. Very soon when I was in the UK, I saw stones being removed by endourological methods. That's without making an incision. And I was really very enamored by that. I had my plans to come back, so I came back, but I went back again. Went to UK, to Germany, and to the US to do stonework. And I came back and I was a pioneer. I was the first person in India to start percutaneous stonework.
That's really nice.
That was many years. That was in 1983.
Wow. Impressive. That's nice. So, sir, how many patients out of 10 comes to you of prostate, stone, cancer and others?
Because my interest is in stones, I would say 50% of them are stones. And the rest of them are far. My second interest now is prostate, ever since the robot came. I picked up the robot when I came for the last more than 10 years. I've been on the robot. So prostate surgery has increased. And along with that, all the urological cancers. That's prostate cancer, kidney cancer, bladder cancer.
Okay, so what is the major lifestyle issue you see in your patients?
How do you mean lifestyle issue? I would say the major lifestyle issue all over India is obesity. To a lesser extent, smoking. I find smoking is an issue which is not as bad as it is in Europe. I still think smoking is an issue. I don't come across any patients who have problems with tobacco chewing because I'm not a head and neck surgeon. But I guess tobacco chewing is also a big plague in India. But smoking giving rise to bladder cancer and obesity giving rise to a variety of problems with prostate cancers of all kinds. It's underestimated how much of a problem obesity is.
So you have experience of 40 years and all these years with all the coming generation. So I would like to ask one question. With the advancement of technology and readily available information, has the relationship between doctor and patient changed?
Not if you don't want it. It has changed in some places and I have fought it.
Okay.
Because I feel that the relationship between the doctor and the patient is all important. Increasingly, if you're not aware, if you do not prevent that from happening, the patient will become a cipher.
Okay.
And that is not what the patient wants. You will accept it if that's the standard of care. And say, I get excellent care, doesn't make a difference if I see X, Y, or Z. I go to hospital, I'll be treated by somebody who I hope is competent.
Oh.
But there's no personal relationship between the doctor. That's happening to a great extent in the US. I don't think it's a system of care in India. I would like it to remain the way it is. Where you go to a doctor, you go X, and you have a relationship with X, he operates on you. Sometimes I feel it's a bother because of operating, I get phone calls directly to me. And they all have them very competent people. But I will get phone calls directly to me for sometimes it was trivial problem that the patient is having. So far I've resisted the temptation to rush off those calls or to even go on to juniors. I'm outside it because I think that relationship, that bond between the patient and myself, which is an individual bond, is very, very important. I don't want to have a bond in a department. for a hospital. I don't want. Whether that's going to happen in the future, I don't know. I'll resist it. I think I reserve the right to come to a certain age when I can work in the way I want to.
And that is also very important to make a bond between two people. Why? Okay, that is important. That is the trust they are having on you.
Absolutely.
So, sir, how would you rate the advancements in medical science in India when compared to the West?
When I trained, I used to always say, oh, we are 10 years behind. Whatever advance came in the West, and we used to read regularly to keep abreast. 10 years behind. That was me more than 30 years ago. Now I would say we're not even a year behind. And in many cases, we are a year ahead of some countries. For example, the US. US is a very stringent law that prevents certain advancements to come in. As a result, we've got advancements before the US has got. But then we look at something, we find something in Europe, technique in Europe, we tell our people of the hospital, and they purchase it if they think it's. So we get advancements very quickly. So I don't think we are behind by any lag, hardly any lag. What we lag in is pure research.
Oh, yeah.
Which is still slow. There is no pure research. There is a lot of clinical research. There's a lot of clinical innovation. Indians are very innovative. And they will do a good job in innovating surgeries, etc. There is something called pure research where you work on the cause of why things are happening.
That's also very important.
Very, very, and it guides what is going to happen
Exactly.
next 10 years and more. And that is an area where we are staying in maybe 10 years.
Okay. So the last question, how do you see the future of Indian healthcare sector? Right. I think with better, I wouldn't call it government, I call it authority participation. In India, the president of healthcare is divided into the haves and the have-nots. The haves have an excellent, you understand what I mean by haves? People who have resources, money. They have an excellent access to the best possible healthcare. Whereas the have-nots, that is the poorer people, do not have access to top-of-the-line healthcare. I don't mean they're a plushy rule, but I mean you should get quality healthcare. That doesn't happen. And that can only happen here. The government, in quotes, steps in. How can that happen? When the government makes it sure that everybody has universal health. That can only happen through insurance. So everybody should be insured with the help of the government. Exactly. True.
So that is the most important. And then with that, the government should put up health centers which are state of the. They have to be state of the art. You cannot say that I'm a government hospital or a corporation hospital. Either I would have just a mediocre. And there was duplication.
Mm-hmm.
It's a big country.
Yeah.
Unfortunately, you have the implication of
Everything.
everything
Yeah.
in the smallest possible. Because despite the fact that we are a country where we require free enterprise, but the most free enterprise country, completely free. Anything you want.
Yeah.
There is no regimentation at all.
There is nothing which is pulling us back. We are having that freedom to do anything we.
Absolutely. Is it a very small place like Mumbai? I want 13 robots. Anyway, it's 14 robots. And a 15th will come in tomorrow if he has the money to put in. But adjoining place, maybe Nanded, will have nothing. I'm just giving you examples in Maharashtra, which is where I come from.
It was a really informative session and I really loved talking to you. Thank you so much for coming and sharing your journey, thoughts and experience with all of us.
Thank you.
It was great having you.